Have you ever noticed that people everywhere are always worried about something? Fear of the unknown and that which is beyond human control remains a timeless aspect of our inherent nature. What's more, this universal level of alarm is often displayed, while genuine issues of concern become discounted. It is almost as if we fill our head with so much misplaced anxiety that there is no room left for valid concerns. The current flu epidemic, for instance, is killing more people every year than natural disasters and can be prevented, but is largely ignored. Hello, my name is Delia Garcia. I'm a registered nurse by trade, but I am here today as an educator and an advocate for better public health. Thank you all for taking the time today to attend this brief lecture. I am pleased to be here to discuss the barriers for and the significance of implementing broad public vaccination against the influenza virus. In our community and our society, vaccination rates in the U.S. can reach the desired threshold for the prevention of influenza. It is common knowledge that influenza or the flu is preventable and highly contagious respiratory virus which is spread by contact with contaminated surfaces through inhalation of droplets which travel through the air, droplets originating from sneeze, cough, or an infected person that will often land on commonly touched surfaces such as door handles, armrests, grocery store carts. Consequently, others who later touch the surfaces will likely become infected by touching their eyes, ears, nose, or throat if they do not have proper antibodies present in their immune system. The characteristic signs of influenza begin as a febrile respiratory type illness with an acute onset. Likewise, flu symptoms encompass both respiratory and constitutional, a whole body system. Respiratory symptoms include cough, congestion, while constitutional symptoms affect the body such as fever, chills, and malaise. Mild influenza symptoms typically appear 1 to 3 days after exposure, with the duration of 3 to 7 days. Some symptoms such as cough tend to linger for as long as 2 weeks. Influenza type A correlates with elevated mortality rate in a vulnerable population, which is often due to complications of pneumonia. Because influenza is viral, there is no cure. However, antiviral drugs such as Tamiflu can significantly help decrease the symptoms and shorten the duration. Vaccinations save lives. Unfortunately, however, when it comes to influenza, it is undeniably that which we do not know that can hurt us as individuals, but also as a society. In the U.S., influenza has already reached the epidemic threshold. In fact, just last month, a 6-year-old boy lost his life to influenza just before Christmas holidays. Here I have assembled data and created graphs which illustrate from various sources to show the efficacy of the influenza vaccine. It shows the rates of distributed doses, mortality rates by age, rates of vaccination coverage, and efficacy of protection against the flu. In fact, according to state health departments, most of the time the flu shot will prevent the flu. In scientific studies, the effectiveness of the flu shot has ranged from 70 to 90% when there is a good match between circulating viruses and those in the vaccine. Getting the vaccine is your best protection against this disease. While numerous facts may impede the ability to vaccinate against influenza, for a small number of the population, many people simply choose not to vaccinate for the wrong reasons. Misconceptions surrounding the flu shot and vaccines in general do not remove evidence-based studies which prove the efficacy of influenza vaccine. Cost, access, availability, and true allergy are common barriers to immunization. Perceived barriers are false assumptions or ideas which often include misrepresentations concerning vaccine ineffectiveness, fear of contracting the flu from the shot itself, and the potential of harm to come with the vaccine ingredients. No intervention at all was the most expensive and least effective option. Insensitivity analysis, lower vaccination costs, higher annual probabilities of influenza, and higher numbers of work days lost due to influenza made the vaccine more cost effective than treatment. At this point in the presentation, I would like to answer any questions. Yes, ma'am.
Yes. Thank you. I just wanted to clarify that the flu shot does not cause the flu?
No, the flu shot does not cause the flu. The vaccine preparations do not use the live virus, so the vaccine cannot cause the flu. The nasal spray flu vaccine does contain the live virus. However, the viruses are attenuated, they're weakened, and therefore cannot cause the flu illness. Yes, sir. In the back?
Thank you, Delia. I was wondering if you could briefly discuss the side effects of the flu vaccine once again for review.
Yes, the vaccine has the possibility to produce side effects. It can vary depending on the individual and the type of inoculation received. The injection site may result in some redness and soreness, little swelling, low-grade fever, body aches. And the nasal spray, which is not injected, some of the side effects would be runny nose, wheezing, headache, nausea, vomiting, muscle aches, and fever. And I have time for one more question.
Hi Delia, I was wondering, are there benefits for vaccinating children that outweigh the exposure to chemicals within the vaccine?
Yes, in fact, there are many. Immunized children have fewer middle ear infections and may be protected up to 1 full year. Barriers directly affect the public health and are harmful to those who face true barriers. Perceived barriers are easily remedied with information, while true barriers are mitigated through herd immunity. Those who can take the vaccine have a duty to protect vulnerable populations and themselves from the flu. In conclusion, the flu vaccine is safe for most people. Harmful exposure to ingredients of concern is diminutive and in comparison to incidental and daily environmental exposures. And the vaccine provides necessary protection from grave illness while promoting herd immunity within the community. Thank you all for being here, and I hope you all have learned something new and enjoyed this presentation. Have a great day.